Okay, back to the anthology. This is section 2. Let's read it. This Wilcockson Anthology 4 in Ethics A-Level. The official position of the British Medical Association, for instance, suggests that there's a great deal of difference between actively terminating life and treating a patient in a manner which may end in the result in death. In its ethical advice, the BMA emphasises that it is the duty of a doctor to ensure that a patient dies with dignity and as little suffering as possible, but recommends that active intervention to terminate life, that is, where drugs are given or other procedures are carried out in order to cause death, even at the request of a patient, even if at the request of a patient should remain illegal. So, rights and responsibilities of doctors. This is a quote from his text. So, that active intervention can terminate life. That active intervention can terminate life. That's the key issue. Active, voluntary euthanasia, where it's the law is really at, where people are what people are really discussing. Everything else is a smoke screen. Should we recommend active intervention to terminate life? That's the gold standard. That's what everyone wants to find out. It's not passive euthanasia. It's active, voluntary euthanasia. But you can't unpick it so easily. So is this statement by the British Medical Association clear or not? What do you think? You could give your reasons. What is just the official statement of the British Medical Association? That there's a distinction, a difference between actively terminating life and treating the patient in which manner which may result in death. Is there a difference? Is it simple? Well, yes and no. Obviously, if you're pro-choice, you're going to argue about its complexity. That seems to be the case. What's going on here is the difference between active euthanasia and passive euthanasia. So what's active euthanasia? Well, every doctor used to have considered it to be a duty to save and preserve life whenever possible. Doctors used to take the old form of the Hippocratic Oath, which says, I will give no deadly medicines. It doesn't say that now to anyone who asks, nor suggests such counsel. So this used to be form the basis of the British Medical Association's opposition to euthanasia, but not so now. Does the British Medical Association in this text sound that way? Well, it does. It's the duty of a doctor to ensure that a patient dies with dignity and as little suffering as possible. That's palliative care. So active euthanasia to terminate life, where drugs of a patient should remain illegal. Well, that I will give no deadly medicines does sound very much like we're still on the side of the old Hippocratic Oath, but it's changing. Passive euthanasia is accepted by the British Medical Association. It states that there is a large difference between killing, active euthanasia, direct killing, and passive euthanasia, indirect killing, even if they don't speak of the latter as even a case of euthanasia, but rather withholding or withdrawing treatment. That's important language. It's not euthanasia, it's withholding or withdrawing treatment. And that's a whole world of difference, they would argue, and pro-life people would argue. So, why do people no longer take the Hippocratic Oath, or take the original form, you might argue? And how has this resulted in a change in attitude, at least in the higher echelons, in the leadership, in those that make and shake and move in the British Medical Association? Well, notice this. The BMA has changed its stance to a so-called neutral stance, a neutral position on assisted dying. In fact, what's happened has been a great deal of advocacy in recent years by the dignity and dying lobbyists and the politicization of the BMA. They don't just lobby, they actively lobby to have people in positions of authority, positions of power who can change policy. And so policy has changed. And it may be that it's changed against the democratic wishes of the members. So this move in its position to a more neutral, or perhaps, it depends how you read it, a pro-euthanasia stance. What do you think? Yeah, what this does mean is that if individual doctors are against the practice, are they against their own professional body? That's really interesting. What about religious doctors? Well, what's your view? Do we need active voluntary euthanasia? Lots of people would say we do. Here's this guy here, Terry Pratchett, very famous advocate, now deceased. Did he end his own life? Is a big question. Now, he was well, do we need it? There are, as it says, there are drugs, but there are drugs that can be used for pain relief, not to kill the patient. This is palliative care. It's seen as the alternative. The hospice movement was started by Dame Cicely Saunders after the Second World War in reaction to what the Nazis did between the wars, because they were doing euthanasia. The reality is, in Britain, no patient should be in pain. Now, the talking point, the pro-choice talking points, where we should respect wishes of patients, and this deeper autonomy view of people like Terry Pratchett, is hiding another argument, a subjective view, that only I should decide when my life has value, whatever the actual circumstances. It shouldn't be about any objective idea of pain. It's my subjective choice. So if drugs can actually treat the pain, that ends that argument. But pain is now being redefined, which is important to understand. That was section 2.